Hi, how are you everyone? It's my pleasure to be here, and I feel like being here every day is like being home. So this is my second home, Pakistan. Thank you very much for having me. So I'm talking today about my experience in threads and in holistic approach treating the face using threads and combining different procedures and techniques. This is what gives the right and good and perfect results that we want and our patient needs. So we need to combine everything. We cannot just rely on one treatment or rely on one technique. We need to have a lot in our hands to do that. Threads are one of them. It's not the only one, but it's one of them. So I always look for meanings and threads, what it means to me. I found the ASAPs, they do a really good definition to it. It's a temporary suture that produce subtle, but visible lift. So it is not a facelift, not a surgical facelift procedure. It's a subtle treatment to the face. So you add it to your treatment plan. That's how you keep expectations for the patients in the right place. And when I talk about threads, I usually think about classifying them. So we need to know how it is classified so we can understand how to introduce it and how to fix our tissues and how to know the right technique for it. It can be absorbable, non-absorbable. It can be different materials like the PDO, the PLLA, the PCL, and so on. The application, is it a needle and cannula? Does it have entry and exit point? Does it have an entry point? Is it barbed? Is it smooth for rejuvenation only? Is it twisted and screwed? There is different type of thread material that work with different things that we need to treat all over our faces. Is it for rejuvenation? Is it for armoring? Is it for lifting? Is it for both? We need to know that. And we need to understand that the face is not just done or split it into thirds or fifths. So the face, usually, it's regions. And the regions are, we have two regions in our face. The mobile part, the anterior part, and the fixed part. And that work was done recently. And we need to understand this. And especially dermatologists. Plastic surgeons know that all the time. But when we talk about it, we need to know that the fixed part, which is the lateral part of the face, it has a very specific function, which is chewing, it's eating. The temporalis, the masseter muscle, and the layer constructi here are different. You don't get the same layering as you get in front of the face. So the muscles here are attached to the periosteum. It's a completely different function. And we have another function, which is the expressions, the talking, the smiling. These kind of expression, they move all the time the skin. So it creates shadows and it creates wrinkles. And that's how we try to fix the mobile part to the fixed part of our faces. And that happens through ligaments. Ligaments are an integral part in the structure of the face. It starts from the periosteum. This is for true ligaments. And it goes up to the retaining ligaments of the face, and it pierces this mass, and it's part of this mass. So it's part of the muscular structure of the face. And then it forms the retinacular cutis, which is part of the dermis. So that's the end of a tree. So what threads does, it integrates into the retinacular cutis, and it reinforces the collagen deposition at that part. And this part is fixed to the periosteum. So you attach your threads to the periosteum through the ligaments. You should choose a fixation point that goes by a ligament. This is how you have a good fixation on the face. We have different types of ligaments. We call it septi, adhesions, true, false ligaments. They all form the same thing, and they all attach the layers of the skin and fix them to each other. The names doesn't matter, but you need to know where they are and what they are, because they help you. And when we do a cadaver dissection, we see ligaments. It's there. It's not just on drawings. It's there. So we need to use them to fix our threads. And this type of adhesion creates also a separation between a moving part and a mobile part. And that's obvious in cadavers as well. We can see it very obviously. And ligaments also have compartments in between them, which is superficial and deep fat. And superficial fat is the fat that help the muscles to glide with the skin. So the skin with the fat glides on top of the muscles for us to move naturally. So when you disturb that by more fibrosis that you create with any type of treatment or a lot of filling to this one of the compartments, you get unnatural movement of the face. And these compartments are so unique and separated. If you inject dye in one and each compartment, they don't mix. And when you do the dissection, that means that these compartments are like chambers. It's there. And we reposition them by using the threads. So it's a type of repositioning of these compartments and reinforcing the collagen boundaries and the fibers to their places back again. And remember, it's superficial and deep, and they are layers. So on threads, we deal with the superficial fat compartments, and with volume, like fillers, fat grafting, we deal with the deep fat compartment. Deep fat compartments are there for structure and for support. They support the facial structure of the face, and they are layered on top of each other. And this is the deep fat by MRI. You can see how deep attached to the periosteum they are. And when we age, we need to understand that we wrinkle, sag, and we lose bone, fat, laxity of the ligaments and muscles. Tone changes, but at the same time, we still express. We still laugh, get sad, and get angry. So we need to keep that in mind in our treatments. We're not static. We're changing all the time. Either we're aging or we're communicating. So if we try to fix that, even in surgery, and we don't take care of the superficial fat compartment like the nasolabial fold, we only do the deep mass lift, we still get a nasolabial fold. So this is a surgical paper on how a facelift can get better result by plicating the nasolabial fold and attaching it back, which is exactly what we do in threads. It's the same thing. And this is one of my cases using Excellence Visage, a very unique type of threads. I'm going to show you today on the demo that this one can lift the face completely, adding volume at the same time, creating a nice vector of lift, creating a useful look. That's her right after the treatment. See how lifted you are, the jowls, the nasolabial folds. and the volume that you can create using this type of thread. That's another case, another heavy tissue that we need to lift and volumize. So we can lift and volumize, taking care even of the tear trough deformity that she had. Using two types of threads at that point. So the Visage, the Excellence one, which they come in 5 and 5, 10 threads, loaded on a cannula, and the thread method one, which is a double needle thread on barbs. That creates nice jawline, nice lift to the neck, and to the cheeks and mid-face as well. That's another case. Using a different type of thread to the neck. I used also liposuction at the same time. That's 2 weeks after the procedure. And I used threads for her mid and lower face as well. And this is her after 6 months, having beautiful face, using a bit of filler, blepharoplasty, upper lip lift as well, and using the threads for the face and the neck. That's her from the side. See the definition of the neck, how you can create that. I still have the patient that's 2 years now. She's still having a good results after 2 years. Another patient doing the eyebrows, the mid cheeks, and the lower face. She's already beautiful. She doesn't need much. So you can just give her the fixation and the armoring of the tissues just to stop or delay the aging clock for her. And don't forget, that's a PLLACL hyaluronic acid blend. So it creates hydration, rejuvenation, and collagen and elastic deposition as well. So you're inserting a PLLA material under the skin. And that's a different type of threads. It's Nano Excellence. That's the shortest ones. That's another case for the mid face and the lower face. Using two types of threads as well. I'm going to use that combination today on our case. That's her from the sides. Elevation of the tissues and repositioning of the fat compartments and the laxity. You can also do the eyebrows, creating a nice eyebrow lift or fox eyes. That's another case for the neck and volumizing the mid face and the lower face. So adding fillers to your treatments gives you better results as well. So she has better mid face and beautiful neck. That's another case, doing the mid face and the lower face as well. You can also do the nose. Why not? Because there is a specific type of thread for the nose as well.